There it is. There's the red circle. Hi, I'm Martha Noah. I'm program coordinator here for K-12 engagement at K-State. Today we have a wonderful guest lecturer, Dr. Matt Miesner, who is going to address the topic of critical care of calves. So I let you take the gander.
Thank you. It's fun to be here. It's fun. Our crew is online, which is always a good time. They come visit now and again. So this year did a little different topic. And what it's intended to be was to sort of introduce you to some of the specialties and an area that a lot of people don't think of. So we think of intensive cares and NICU units and humans, and a lot of people have gone to the small animal veterinarian or the specialist there. But we do some pretty technical intensive care even in calves and livestock. And so I kind of introduce you to that. That's what we do. And then kind of go through some little specifics and things of hopefully to trigger thought processes or get little keywords planted in your mind if you're thinking of going to vet school. And so these things will visit you in depth later on. We won't go too far into them, but it would be something that would be something that you'd learn later on. So who am I? So I'm Dr. Matt Miesner. I am an associate professor there at K-State, and I've been there almost 10 years this year, and it's a fun place to be. So as many of you find, or others, that the diversity or the things that you can do as a veterinarian is pretty wide. Okay, so Dr. Elmore and some others that discuss just recruitment can tell you a whole list of different areas and then still miss some. Okay, what I do, I started out as just as a practitioner. That was what I was going to do, and I've evolved to where now I teach and see patients in the university, and I've gone further to a point where I just see livestock or large animals in most of them. So I get to still see my patients, I get to treat them, I get to try to prevent problems, but other cool things that I get to do a lot of is teach. So I have students with me all the time. So when I'm seeing these, I have students with me. I do a lot of phone talks. So I talk to a lot of veterinarians as well as not just in practice, but in the university as well. So I see those, and then at the same time, if I see something that's cool or things that are bothering me or in these consultations are becoming problems that get asked a lot, I get to get involved or try to figure out research projects to figure out ways to answer those problems. So it's kind of a neat balance. I don't just do research, I don't just see patients, I don't just teach, but I have a pretty good balance of it. So I get to talk to a lot of people, a lot of veterinarians, a lot of students, and it's just a real large time. So to that route, how did I get here? So I spent 5 years in undergraduate. Actually, I finished at New Mexico State, where I'm from. I started out at the junior college to get things going, start figuring out how to pay for that. Went through 5 years there, then another 4 years in veterinary school. And to find out to apply those, I went to Washington State, which is one of 20-some veterinary schools in the country. Okay, so kind of hit an upper northwest corner for 4 years. And then at that point, my plans were to just practice. So I was going to be a mixed animal practitioner, seeing small animals, large animals, you name it, and just work that way. Didn't take long for my wife, who's also a veterinarian, to decide she was going to do an internship. So we ended up in Columbus, Ohio, and I was just looking for a job. Ended up figuring out that you can then go back and specialize, go back to school for another 3 years, do a master's degree, and take some serious in-depth training on specifics of whatever species you're liking. Okay, so I grew up sort of a rural area, and I spent a lot of time with livestock and horses, and I really enjoyed that. And I decided to specialize in those. That's usually another application process to get accepted to these residencies or post vet school training things. So I spent another 3 years doing that. There's a whole another set of examinations in order to become board certified in a specialty. And those are pretty grueling and somewhat expensive, but in the end, you know, if you want to do it, get through it. Then I had the same option. I could go right back to here, okay, and practice, which is something I really wanted to do. I enjoyed it. But the opportunity came to stay at Ohio State and start doing kind of what I was doing now. And I really found that I truly enjoyed that, and that's kind of where I stayed. When we finished there, that's when we moved to Kansas State. So I've been there ever since, and it's one of the neat things. At any point, you know, if I really felt, I'm getting far away, it's been about 17 years now, but I could go back to practice any one time. Sometimes it's just scary to me to go back to do that than it is to stay in the university. But so that's the root of how I got here, and things that I could do. At this point, I could still go into industry. I could still go into a whole lot of different things. So let's see livestock. Okay, so in a definition of livestock, we need to figure out what is that. Another reason I like where I'm at. Okay, so if I was to specialize in small animal or equine horses, I'd be fairly limited to a type of species. What's kind of neat about livestock is it still keeps me in that realm of a whole bunch of different things. So livestock's a pretty wide definition, right? So for the most basic one is a domesticated species with a job, right? And usually something that has a commodity attached to it. And so, yes, I'm making decisions on health and those kind of things, but a lot of them I'm also having to help make financial decisions based on the output of that patient. Okay, I have a lot of pets, so even though it's livestock, I still think that some of those commodities are, you know, enjoyment from people. So we still see a fair number of small miniature pigs. I see commercial swine as well. Goats, I think I see as many pet goats that hang out with the horse in the stall as anything, you know, so those are fun. Then we still have the domesticated, somewhat tamer wild animals, so we do see a number here. I get to consult a lot with zoos. There's a lot of ruminants, a lot of livestock there in zoos, and as a specialist in that area, we talk a lot about that. So camelids, as well as the alpacas, we have commodities of fiber. Okay, so we got meat. We've ever seen goats, labor is a commodity as well. So there's some pretty neat areas, rural areas where they have just herds of goats. Now go into these suburbs and clean up people's yards with goats. It's pretty cool. You know, so that's kind of a neat thing. But so I get to see a wide variety of species of livestock type species, and it's everything from pets to real working individuals. So it's fun, and that's kind of where we're at. It's not just, sometimes you hear my residency was a food animal residency, but a lot of the livestock that I deal with are not really food animal. So today, what I thought we would do is talk about one of the neat, kind of more specific parts of what I do as a specialist, but not necessarily something that we have to do just in person. So there's a lot of critical care that gets done in private practices around the country for those that are set up for it and have continued to build upon their skills and their equipment and what they have to offer clients. For example, this little guy was a product of one of the topics we'll talk about today, which is a dystocia, or having trouble having a calf, and so he ended up with a broken jaw. And so this little guy required quite a bit of care and support for a few weeks while his jaw healed up. We have ways to do surgery on those. This is a method that we had read about and we talk about, and people doing research have done taking ideas and taking these thoughts into ways to try to just cast it or support them. So he almost gets a gravy boat for his jaw to lift it up while he heals. And the cool thing about calves is they're so resilient. I mean, this little guy, even though he had a broken jaw since birth, never really missed a meal. I mean, it's amazing. You know, if anybody's ever had one, I've had friends that had jaws wired shut. It was quite painful and different things. But this little guy never really missed a beat. They healed pretty rapidly. So by a couple of weeks' time, he's cast is off and we're ready to go. One of the things that weren't so great is that mom's udder got this cast full of a lot of milk in it. So sour milk gives you a whole new perception later on. But we can change that, and he did grades, you know, so we have different things that we see. Some of those are less common. The more common things, so we're going to talk about dystocias, okay, diarrheas, and the deep freeze calves. I think that when we talk about critical care babies in the cattle industry, these are the top 3 reasons that I have them, and the top reasons that they get into trouble. And so I'm going to go through dystocia a little bit more. The diarrhea type situations are another topic all in themselves, and I don't think we'll have time in this kind of thing to go through it. And then we'll talk a little bit about cold stuff. So let's talk about dystocias first. And I think that we get to really pat ourselves on the back, not just veterinarians, but the whole agricultural industry, beef industry, dairy industry, cattle industry in general, in that prevention has been astounding in the last couple of decades. The number of cows having trouble calving is greatly reduced just based on preventive genetics, okay? So we can recognize bulls that are going to have calves that are smaller when they're born, okay? And cows help it shape. We can select for that, and we can therefore eliminate most of the dystocias, okay? They're still going to happen. There's still times when you're not going to have the easiest way having birth, okay? But prevention has been great just on a genetic standpoint. Then we also have recognized things to watch for. So timing. When does a cow start to calve, and when should we intervene? Okay, so figured out it's within minutes or hours in some situations, and the quicker we get to address it and make a plan, we can eliminate a lot of those problems. Okay, and then we always keep up with different changes in treatment. So as a veterinarian, one thing that you have to really keep up with is the stuff that I learned in vet school 17 years ago. It's not necessarily the standard of care now. And so the type of fluids that I would use or the techniques that I would use then may have changed. And so it may not have, but it may have. And so we try to keep up with what is the standard or the expectations currently. And so that requires quite a bit of reading and continuing education after you're done. You'll have formal education, but you also have journals and topics and things that you read, and it's a lot easier now with the online type of stuff we have. But we'll prevent them, we'll plan for when they happen, and then we want to be sure that we're up to date. So it starts here. These are some friends of ours in Iowa, some ranchers, farmers up there, and they are very important. Any producers is the stage 1 of our plan and our prevention. So they've already selected for genetics. They're hoping that they limit all their problems having a calf, but then they're going to be vigilant and take care and watch closely. And a lot of these guys are spending all night, all day, every hour or less, watching for problems or somebody that's going to have trouble having a calf. Okay. Now they recognize certain signs. So sometimes it's going to be isolation. Cow's off by herself. Sometimes the tail's high. Sometimes it's just a weird gait where they're kind of walking wide-based or vocalizing. Or now I've even seen situations where you have other cows kind of making sure that they're okay. But they can watch for a lot of signs. And since they live and monitor these animals on a routine, regular basis, they would recognize some signs and behaviors that we wouldn't recognize as a first time onto the farm. So prevention starts here from genetics to finding the problem. Then often even here, if they start to have a problem, the farmer rancher is going to intervene before the veterinarian even sets foot on it. Okay, so there's still a lot of this that gets taken care of by the farmer rancher. Okay, so they still pull a lot of calves. They still figure out how to manipulate things and go from there. So one thing is, who knows what I should have started with. What is the definition of dystocia? Anybody? Will I be able to hear them? No. You have a definition of it? That's good. I'm glad I stopped here. So now it really basic is just a difficult birth. So dis is abnormal, it's just sort of a difficult birth. And we know what causes those, okay? So what we could do, we could spend a whole nother hour talking about positions, awkward positions that the baby gets into that just won't allow him to come out, okay? We also know that they can be too big, or mom's pelvis is just too small. The birth canal is too small, and that's one thing that you try to eliminate with selection and genetics. Then we have these things that we just can't help. So sometimes, for some reason, they just don't dilate enough, or they contract down too early, or they just don't have problems. So we know what's causing it, but then we just have to try to counteract those kind of things. Okay, so size and some of those others are a little bit more difficult to deal with, but we have to recognize them. Okay? So from here, once we recognize we've had a problem, to here, to get this little guy happy and sitting up, sternal and breathing on its own, there is a amazing amount of events that have to take place in a very short period of time. Okay, so for example, we know that by the time a cow dilates and her flag and her tail's up and she's starting to push, she's in an active labor, she should, if she's had calves in the past, she should have it out within an hour. I mean, it should be on the ground, happy as good to go. So our guys out there watching in the pasture see a cow that's had 3 or 4 calves in the past without any trouble, starts to have a calf and starts to push, and nothing happens. Like, we go and check on others, and they come back, and she's still doing that in an hour, hour and a half. It's time to look, because there's something that could be all of a sudden just got positioned wrong, or she for some reason didn't dilate, or she's exhausted for some other reason, that maybe she's got calcium problems. You can have eclampsia type things in cows as well. So you have that kind of thing, and they check early versus a heifer. So a cow that hasn't had a calf yet, so a young female that hasn't had anything would be a heifer. They tend to take a little longer, okay? But we're still going to check soon. So they might be 2 to 3 hours when they actually have it. But if she's pushing and she's having trouble, we're going to check with her, okay? So first is checking, and then, like I say, there's a whole lecture on how these things get positioned. And I can tell you that in the long time that I've been doing this, they're all different. We had one this morning as I was trying to leave to come down here. It was yet a whole new learning experience on how the calf can be positioned and make your job interesting and challenging at the same time. Okay, so we're going to reposition it, and then once you reposition it, we're going to have a whole series of events that have to happen while we're getting it out. And then as when it hits the ground, there's things have to happen within the first 5 minutes that we're going to intervene on to hopefully get a calf that's self-sustaining. And so that's kind of where we'll kind of carry on from here. So dystocia is difficult birth. There's a whole bunch of things that can happen. And I mentioned that with the livestock species, one of the things that we have to recognize is that that calf is going to be money, a financial investment for the client, right? So I can tell you that young calves, if we were to sell a calf several days over, right now market, they're probably selling for $300 to $400. So that's just the calf that's born. If they were, for some reason, something wrong with mom, they had to take the calf to a sale, you got $300 to $400 for a calf that's just on a bottle. If they are going to feed it, they're going to sell it later on, we're talking thousands of dollars down the road. So getting that calf, a live calf, either to ship in the fall or to retain in the herd becomes a pretty good financial investment. And the big time that they're going to have problems is right here at this starting point. So if there's trouble having a calf, we're going to have a lot higher loss early on. So, and it's really high, so 70% right at the time of calving. So that's when we really got to pay attention. That's when we really got to be on our A game to have things go on down the road. Also, it doesn't just happen at birth, but we look at down the road. So we have trouble having this calf. The slower it takes us to get him going and standing leads to problems down the road. And usually that has to do with their immune system. So so they don't feel so well. They have a hard time absorbing nutrients early on. And so we're recognizing that we're going to have troubles down the road. This becomes a really important thing when we talk about prevention in the future. So should the cow have a problem that year, or the bull has been having a lot larger calves than anticipated, that's something we're going to try to prevent for next year, because they can still have issues. And all of these red things are all areas of research where people have either gone back through the literature and kind of figured out these problems, or they've actually induced kind of things where we can follow the outcome of these individuals. So this is kind of some of that research part that we get to do. So that's fun, and we keep up with those kind of things. As a veterinarian, so like I say, the farmers and the ranchers can intervene quickly. Something's not going right, they can't get it out, then the veterinarian is usually called. And what we can provide as not just a specialist, but being a veterinarian, we've learned ways to provide lidocaine or medication that we can inject in the tailhead that essentially numbs her hole back in, and now we can stop her from pushing and reposition the calf. So we can do things like that. It's a neat term just to kind of keep in the back of your mind, but things that we have to allow us to dilate the uterus, or if we're not having enough room inside there, we can provide some medications. And actually, yes, that's epinephrine that we can provide that just dilates the uterus. And so now we can have a little bit more room. We can sedate them. So if she's pretty stressed, you can only imagine if she's been trying to have this calf for a couple of hours, things aren't going right, they get pretty stressed, and so they can be a little bit agitated. So sometimes we can sedate them. And then in the end, when we get this calf out, if we're in that critical point, like I said, the first 5 minutes is pretty critical, we can resuscitate or revive this calf. And we've learned medical techniques. We have the equipment to do a little bit more than hope that he starts breathing okay and is doing all right. So we're there to do a little bit more, okay? And here's where it gets a little bit scientific as we kind of go through it. What are we looking for, okay? So you can only imagine, here's our front feet, here's the nose of this calf coming through there. It's pretty tight, and we're having to assist him to get him out. You think about you being squeezed in the tube for very long, it's hard to breathe, right? So fortunately, this calf, until we get to this point, is living off mom's oxygen, right? So he's in the uterus, everything is good, but as soon as that umbilical cord starts to stretch too far, he's going to start trying to breathe, okay? And we know on a level about this size, so usually about the time that nose gets about here and our feet are past our elbow, that umbilical cord is starting to stretch pretty tight, he's going to start trying to breathe. And so we get to a critical control point here that we have to get him out pretty rapidly. But in the meantime, he gets low on oxygen because his umbilical cord shut off. Now he can't get any breath because he's squeezed here pretty tight, and they get hypoxic or low on oxygen. The low on oxygen leads to a blood pH that really gets off. So a normal blood pH for us, calves and mammals is somewhere about 7.3.5 to 7.4. Okay. For example, some vinegar is about, what is it, 7 or 2 something, pH of 2. So if we think about our pH scale, we get really alkaline or basic out here, and we get really acidic here. Vinegar would be something around right there. This is what we hope to be. And look at this. So this is kind of interesting. Only a 0.2% or decimal point difference to become that acidic can reduce our calf survival by almost 60%. So if we're too long here and it gets too hypoxic, it gets too acidotic, we're in a really critical point here. If we get to 7, we can almost lose almost all. Okay, so it's a pretty narrow window, and it's a pretty narrow physiologic base here on just blood pH. Okay, so can we fix that? Yes, I'll show you here in just a second. So we can recognize that, and we can now take this calf and try to fix the oxygen form and also try to fix the blood pH. And I'll show you just a little bit on how we do that too. Trauma. Okay, so as we're coming through here, it's pretty tight fit. I mean, they're pretty rubbery, even though but occasionally we get some rips or problems, or if we're pulling too hard, kind of worry about legs and limbs, and so we have to take care to make sure that we don't have any issues there. It happens on occasion. Sometimes they go down at the wrong time, hips get locked, and those kind of things. So there's a whole bunch of other things that we're going to assess when this calf comes out, because if we can slap a cast on or do some things right then and there, our prognosis on those are great. Okay, so those, and then we're going to try to limit some of the chronic things. And so the first bit of immunity that the calves get, or lambs or anything, is from mom, and so that colostrum is going to provide all of the immune function or the immune health that they're going to have later on. And so we've got a bunch of things. We're going to try to fix bees. We're going to try to hopefully not have to worry about those. And we're going to try to prevent things down the road by giving them a good source of nutrition. Okay, so that's usually getting milk from mom, or if it's too early or she's having trouble making milk for whatever reason, we have some great products now that are mimicking the colostrum or the proteins and all the immunity from the cow. So we can provide that as a service as well. So we can get this calf going, because we know that just having trouble having a calf is going to make them have a little bit harder time to get going later on. All right, so plan. So we've got this, and we're hoping to stay, and it's going to bypass us. One of the first things that we look at, or that we plan on, is when we reach in here, we make a plan. This comes a lot with experience, okay? That if we think we're not going to get it out the back, it's not going to be normal, probably one of the things we don't do as a last resort anymore is wait to do a cesarean section. So the nice thing about cattle is most of them, once we figured out some techniques that we can know their sides, they'll stand there and eat hay and chew a cud while we let the calf out. Okay, it's not always that easy. But we can take it out the side, and we can save this guy the whole trouble of being squeezed through that birth canal, hopefully, earlier on. And it's easier to do that if we make that decision quicker than it is later. Okay, but that might be where we go. We may try not to. Just a couple of important positions to talk about. So this is the normal position at the top, where this calf should look like Superman, head, front legs come out. But as you can see, as it gets so far, that umbilical cord is going to start to stretch. So that's when we get them out the back. You know what this position is called? So this is a true breech position. Okay, and what we find when we come in here to feel why she's having trouble is we feel the tail. So when we feel the tail, we know that our back legs are up there. This becomes a whole different scenario in that we can get them out the back, which is not a problem. We can take these legs and pull them up. But once this starts to stretch and decides to take a breath, what's he going to get? He's going to get a whole breath of fluid, right? So we plan for that. We know that it's a risk. Are we going to be able to get him out the back? And are we going to get it out quickly? And if we do, there's a good chance that he took a big breath of uterine fluid, and we're going to have to deal with that when we get to. So risk, we're having a plan. We see the situation. I'm going to have a little bit more. His name is Peanut. Peanut, if you look at this, I mean, I wear pretty small gloves, 7.5 average size hand, and that's my hand on his head. Peanut was born, and he only weighed 28 pounds. Okay, the average calf being born is going to be somewhere 70 pounds, maybe 80. Big calves get in the hundreds. So prematurity. Okay, so we've talked about, we see babies on NICUs that are on ventilators. And yes, we have that. We have done that, where we put calves on ventilators. Certainly, financial decisions are made there for certainly higher value animals. But but we've got a whole list of different things. So as our lungs mature, or as feet mature, some of these guys look like they're just little rubber bands, and so they're fun. But I'll get more on Peanut later. Or when we get him out, that's a Hereford calf. He should be white. He's pretty yellow, and so we can tell that this calf is pretty darn stressed in the uterus, just because more oftentimes they pass an early manure or something just from being stressed. Okay, so positions and all those kind of things. We know who's high risk, and we've made this plan that we've got in our arsenal to go. There's no different once we get these guys out than what we would be taught if you had a situation with an individual that heart wasn't going or they're having trouble breathing. And we learned it's airway breathing, circulatory, and then I'm going to add S base on ours, just on our technicality. But so ABCs of saving lives really doesn't change a whole lot with these calves. Okay, so as technical as we can get, and as technical as we do get in the veterinary side, go back to the basic methods or preachings of just life. And so when we get back there, it seems like the technicalities of all those kind of start to fall into place. And so how are we going to improve some of these? We can do some tracheal tubes, we can get catheters, we can use bicarbonate, which is nothing more than baking soda, to alter that acidic calf pretty quickly, okay? But airways, so we'll know normals. So this guy comes out, like I said, we're fighting time, okay? In that first 30 seconds to a minute, he's got to be breathing, or she's got to be breathing. We've got to have a heartbeat in that first 30 seconds to a minute. Okay, so once we get this calf out, I've got a really short period of time to expect this and deal with it if it's this. Okay, so I mean, this is just an example. So if I have a heart rate that's less than 80 or less than 50, what am I going to do? Okay, so most of the time we're going to either start really stimulating them or intervening drugs. And so epinephrine or adrenaline type injections to get things going. We'll get the heart going. We still have to have oxygen to deliver to the heart to get to the lungs. So we'd like to have oxygen. So is he going to be breathing early on? And a normal calf should be taking a good breath within the first 30 seconds to a minute. If it's not, I have got to make a decision on what to do there. And there's some drugs that we can do. But we can also take our trach tubes and we can intubate them and we can breathe for them. Okay, so we have a whole bunch of criteria or cutoff points where we're going to do, because what we don't want to do necessarily is just kind of make this, well, it was a hard pull, let's go ahead and just give this, and this, and we can create some other problems. Okay, but I know within that period of time that we have to be there. Some things we looked at on average is that they should be able to stay sternal. I'm going to show you a video here of a calf that had a really rough birth and how we intervened as we went through it. You can see what we were dealing with. Okay, so sometimes their brains swell, they get fluid, edema, those kind of things. So we get them out. One thing that we're going to be doing is, if you've seen these guys born, there's always a lot of slime and stuff in their lungs, and we're just really going to get them stimulated. So this calf, this was a cesarean section. Get them out. Just having a rough go to get going, but keeping them in a sternal position so you kind of see where they get them up. And so you figure, is it easier to breathe laying down, or is it easier to breathe kind of sitting up? So we try to get them sitting up sternally. So on their sternum and head back. One of the biggest stimulus that's right here is if you take and you put something in your nose or some kind of straw in these calves' nose, even though you just went, oh, gosh, if you've ever had that happen, the first thing you're going to do is really stimulate you. It's going to make you take a big breath. It's going to make you blow really hard. And so probably one of the biggest stimuli that we use for these guys is just to irritate the nose and get them to really start waking up. There's methods that I've seen, okay? So when I was younger, we talked about pulling them out and hanging them onto a fence, okay? Have anybody ever laid on the fence, and how hard is that to breathe, right? If you think about all of your innards pushing on your diaphragm, trying to make that expand to breathe becomes pretty tough. And the whole method of talking about why they would do that was to get the fluid out, okay? And the fluid out of the lungs. And there's some fluid in lungs. Okay, and even if we had one that was born breached and took a breath full of fluid, it would still have a little bit of fluid in there. But what we've discovered with research and time and evaluation is that most of that fluid, because you can see it sometimes fall out, any normal calf born will spill a bunch of fluid, and usually that is fluid that they have drank in the years. And so a lot of that's coming out of the stomach. Not much of it comes out of the lungs. So really, probably hanging them becomes more of a situation where we're creating more harder time breathing, or really not getting a lot of fluid. So what we're trying to do is we're trying to sweep and get all this mucus and nasty stuff out, because that stuff has a little bit of trouble, and we're stimulating them to take their own breath. There's going to be normal fluid in the lungs that gets absorbed really quickly. Okay, so that's not a big deal. Another thing I've seen is swinging. You take and swing them around. Unfortunately, you better have a good wide area when you swing them. You don't want to hit somebody else with them or create other issues. But it's the same thing. It's hard to breathe if your back legs are swinging around the hand and you're having a hard time taking breath. So we don't do those kind of things. Best thing is to stimulate them, and we do a lot of coupage where we kind of pump on their chest to get that stuff going. So over time, some of those other methods really aren't that effective, and then we have to go again. Breathing. So we have ways to either this is a system that actually is set up that you can suck fluid out through that little mask, and then you can provide a little bit of pressure to breathe into. Works okay, but sometimes we actually have to use the tubes because some of the air just goes in the stomach, which it's pretty good for stimulating those guys, coupaging, and then being able to intubate them. There's a way we can do this. We can do it through the nose, we can do it through the throat, but if you've seen situations where you've had to get a main airway, that's one thing we'll do. Doxygram. So this is one of those drugs that, for example, Cap that we had today, difficult time getting it out the bag. When he came out, just would not take a breath in that first 30 seconds. Doxygram actually will stimulate your brain. It stimulates your brain to make them think they need to breathe, and so it stimulates the brain without them being conscious to really take a breath. So use that within about 30 seconds or so, the Cap will start to take his own breaths. It's one of those drugs that if it's not working, we'll repeat it every minute. Because after about 5 minutes, 5 to 7 minutes, it's not that effective. Okay, so we know that. We've kind of done some work with those kind of things. We know that that's a critical point that we need to get into. It's pretty safe. So ways to make them breathe, right? So we may have to provide it for them. We may have to go from there. So this is a calf that we had just this morning. You can see kind of just turkey beige version, maybe shorter. So there you go. We're trying to do is we're trying to make it. Okay.
What's that?
Did a pretty good job of this, but just before that, I didn't have time to take enough video. Because I was trying to get him up and we can put him on 100% on. So
And he's got
one of the ways we can help that pH base is to provide him more oxygen. So that should early on will help out too. Not a great, not a, we have portable oxygen tanks and portable things that you can do
And he's got
now, we're not only giving him oxygen, but we're also altering some of that pH because we said that he was a little bit low. And again, early on within those first few minutes. Occasionally putting catheters to provide fluid support, or if our oxygen isn't working, to then directly change the blood pH with some of our intervention here. Once you start to recognize pretty early on, when you start looking at just this on a basic level, is how quickly you're having to make decisions on doses based on a weight and volumes. And so one thing we've been working kids on a little bit at home is that how important math is every time they tell me it's not. Okay, so it becomes pretty important to make the right choice in that a lot of these calves, or even worse, if you think about goat kids or lambs where you have such a small body size, miscalculating some of these fluids or drug doses can be pretty catastrophic for the individual. In human med, oftentimes it seems like we all get about the same type of dose of a drug. We all take the same Advil or the same thing. But in our patients, one thing that is a little bit more specifically monitored or recognized is that we're going to have different volumes and different doses and different rates for some of these guys. Okay, certainly happens in the small babies as well. But do a lot of calculations, and we may have to change that right off the bat. And there's some wonderful research that shows that pH cutoff range that I can tell you, and how quickly we need to intervene with some of these bicarbonate things. So if I'm going to do this and the calf is not sternal or the calf's not taking a great breath or he still seems comatose, I'm going to intervene with something like this within the first 10 minutes. Okay, so not all of them get it. That calf had a rough go, but he didn't end up getting next medicine. But we have this wonderful crash cart with all of this stuff. Steroids, ways to help them breathe, and ways to keep the heart going. Other ways, so surfactant is one of those chemicals or fluids within the lungs when they're first born, where it doesn't allow them to breathe in utero, and then it takes a while, and you have to overcome that pressure. And I had a statement here early on, I should have gone back. It says that first breath that they take has to overcome about a 4 to 5 time resistance than what they normally breathe with. So the amount of pressure it takes to get that first breath to break through that surfactant and get those lungs and those airways open, it's about 4 to 5 times what it normally is to breathe. So as I'm breathing here, pretty easy to do. That first one that they've got to take to get those lungs open is pretty difficult. But we have ways to intervene to keep that open with different drugs. What about this? So Valium. Okay, so we still use a fair bit of Valium for some of these calves. I'm going to show you one here that has trouble with seizures. Okay, so one thing with this hypoxia, with this acidosis, with this amount of pressure that they're going through, we'll sometimes get brain swelling. Okay, so we'll get edema, and so that sometimes causes a seizure. So we have to correct that before they hurt themselves. And then we use things, some diuretics and other things to help pull that fluid off. But we can recognize this pretty quickly. Okay, so I can tell this calf's eyes are crazy or rolling back in their head, or they're just not with it. We can recognize it and intervene. So again, all of this is happening within that first few minutes. And so what we're trying to do is we're trying to get a calf that's sitting here breathing and happy within that first 15 minutes. And for some reason, that video isn't playing. All right, so here's one. Here's an example. Let's put it together on this guy. Oh, except this. So, twin. So Lynn, this is a twin, 20 minutes old. Unfortunately, his twin didn't make it. Okay, but the farmer ran to us pretty darn quickly, as fast as he could drive. We look at this guy, he's 20 minutes old, so we're way behind the 8 ball here, right? If you look at his eyes, they're really not functioning too well. They almost seem really buggy or dilated. He's breathing, but he's having some labor breathing. You can see how he's taking these heavy breaths, and his eyes are really not functioning. Okay, so this would be a great example of a calf that has probably some cerebral edema, some pretty significant acidosis, and is in a pretty scary spot right now. So that's interesting. So strabismus, that's kind of the term that we would talk to. It's just eyes are positioned abnormal and have an issue. So in this calf, you can see we have a catheter, so we're correcting the acid base. We're trying to get some fluids going. You don't want to get too much, but we also would have to recognize this guy probably has some edema. And so we give him some mannitol. We give him some steroids. We've given him some other things just as he come in. And I'm going to kind of follow this through as we go through him. We actually put him on some he had a little bit of fluids and some other things going, and a little bit of diazepam because when he started coming out, he really started getting pretty crazy. So this is about not quite 10 minutes after that last video. So it happened pretty rapidly, but now we have a whole different set of signs. And so at this point in time, when they start kind of having some maniacal type movements and those kind of things, they coming out of it, he's starting to get some sort of sense of awareness, right? So even if you haven't looked, he's still not in a happy state, but going to be an issue where he's going to hurt himself. So we give him some diazepam and sedated him for just a very short period. Okay, the fluids are correcting those kind of things. This is him this is about an hour and a half to not quite 2 hours later in his stall. Okay, and he's not sure exactly what happened. A lot of changes happened to him in the last hour, 2 hours. But you can start to see he's starting to come around. So in our blood pH, we actually did some measurements, and those things were changing as we were coming around. But again, pretty quick intervention pretty rapid turnaround. And this guy, they don't all do this. And then this is him by that evening when we went home. So anyway, pretty happy guy. So it's a great outcome. And again, they don't all turn out that well, but some rapid intervention. If we would have waited, if the client would have waited an hour even, I have a feeling that the outcome would have been less, but not so problem. So then here's Peanut. So this is Peanut. Peanut was in that baby that was born. Peanut had a reason to take him home, so he gets right home in my pickup because that's how small he was still. And it turns out that he ended up with a family to become bucket calf, and then his career ended up as a grand champion bucket calf with Ottawa County Fair. So again, he was a whole different situation in that he had the will, but he had a bunch of just not quite developed systems. So his lungs, his legs, everything were quite rubbery. So we had to just kind of baby him along for a good period of time. We could give him some aminophylline, some steroids, and some stuff to mature his lungs as he came out. But again, he's 28 pounds. I think he was probably a good 4 to 6 weeks too early. But you just never know unless you try. Okay. Another thing that we get into. So dystocias are one thing. Here's a whole nother realm of problems. This year has been outstanding, right? Some people could welcome global warming, but that's going to be kind of the problems. These calves that are born in the January cold, one thing we know that we can improve survivability by scores of percentage points is just by having wind breaks. So if we get them out of the wind, it's amazing how well we do. Okay, shelter, dry boxes, hot boxes, and other things to prevent it. Okay, is one way to do it. When they come to us, at some point in time, we've got some farmers and ranchers have these heat boxes. I spent a fair bit of time with a classmate in Montana, and they only be born at 15 below, 20 below. As long as they can get the calf dry, get it warmed up pretty quickly, pop them back out, and turn them back to mom in the pasture. So getting them dry was one thing, warming them up and taking care of it. By the time they come to us, usually we're back to our fluids again. And so the outside is great, but if I've got warm fluids, I can now warm them from the inside out. And this calf comes in, they come into a stage of, I have this thermometer that measures body temperature. And a normal body temperature in a calf is higher than us. So normally it's about 100, 101, 102 sometimes. So we've got a little higher range. But some of these calves come in at body temperature of 80 or less. It's amazing if you can get them warmed up pretty quickly. One thing that we don't do as much as we thought is I've found that in my hands, we think warm water baths. We think of cold, we think of those pictures we see of people dunked in warm water baths, which what you also see is that the warm fluids are on the inside. And what we know with physiology is if you think about it, if you jump in warm water, cold water, what happens? Your skin gets kind of flush with warm water, right? And so your blood vessels in the periphery dilate. Okay, and so this guy, those calves that are born like that are trying to support their organs internally. And if I just go and throw them in warm water, I know that their peripheral stuff is going to dilate, and that's going to take some of that blood away. At least that's my theory. I don't have any great research for that just yet. But if we can provide some warm fluids, either we tube them with oral fluids, they've got some warm stuff in their stomach and their intestines, or I can give them warm IV fluids. Then I can then take them and put them in a warm area that's going to help dilate and bring hopefully more of that fluid out. But what's the whole bit of research that's just not out there yet. And so is that the best thing to do? Because I know plenty of calves that if they would have died had they not been taken into the house or into the bathtub and been warmed up that way. So what's the way we do it? We try to warm up from the inside out, but there's a lot of ways that you can do that thing. And it has to be happening pretty quickly. You've probably seen plenty of calves that have missing half of an ear, and so we see lots of frostbites. And, it's amazing how well they do. Have long lives with those kind of things. Probably almost as common reason that we have calves in the critical care system is diarrhea, scours. So the situation where they get infectious organisms or not, just like you would see in any kind of human situation where prolonged diarrhea leads to yet another reason to have not only dehydration and electrolyte changes, but again, the pH starts to drop. And so we get acidotic. And the reason being is that a lot of that nutrition comes out the back, a lot of pH changes. And so we're back to fluids. And so if you go to any private practice that does mixed practice, you're going to see calves in their dog runs or whatnot on fluids or in their own calf stalls on fluids. And there's some practices that I've been to have 6 or 7 or 8 of them just kind of lined up on fluids, and they just kind of rotate them through. What's the best thing about it is these guys, again, are so resilient that you can change those around. A lot of times these calves can turn around in 24 hours and get them back to the and ready to go. Okay, so it's one of those more rewarding things. We then get into a whole different consulting type situation. We're talking about prevention. So how do we prevent those scours and those kind of things? But again, we see a lot of baby calf with diarrhea on fluids, and so that gets into our. That is again, as a whole, when you're in vet school, that is a whole hours of discussions. And it's good to be where now we're not as worried about the bug as we're worried about trying to get them turned around and preventing whatever bug is. So we know we have viruses, we know we have bacteria, we know we have protozoa, we know the bugs about the time that they come in, but we're not as concerned about those specifically. But it gives us an idea when we should intervene. So yes, we've got a bunch of ways to treat those calves, but hopefully we can prevent them. And then I can get into the fair number of the broken leg type situations. But again, what I really like about these guys is that they're so ready to heal, so we can put different splints and casts and different things that we get into. So with that, I think we're kind of running out of time, but I hope that gives an idea of some of the lengths that we could go to get some of these calves turned around, and some of the things that are going through our mind as we're trying to treat them, and some of the plans that we have in place to take care of them. And again, these are techniques and things that can happen in a private practice just as easy as what we do. So I'm not the only one to do these at K-State. So any questions? Had any situations like that?
So scours is always caused by some kind of a bacteria or a bug?
So is scours, question is scours always caused by a bacteria or some sort of pathogen or bug or virus? Not always, the majority are. We do see what we call milk scours. Okay, so occasionally we have situations where the calves just aren't digesting as the milk is, or cow gives them a lot of milk, and it's just passing through. Usually though, those calves they have diarrhea and it's kind of pasty, but they're bright. They're happy calves. The ones that we worry about is when that happens, and then all of a sudden they start getting depressed, they start getting down, they start not wanting to eat, and then we need to intervene. But not all of them, but the majority of the ones that are treating are causing. What's interesting with those is I know about what time a rotavirus happens, and a coronavirus, and a salmonella, and a cryptosporidium, so I know. So, and it's pretty interesting. You can go less than a week for one, right out a week for another one, week and a half to 2 for another one. And so I can get a pretty good idea of what is causing it. But usually it may or may not be that important, other than we know, well, okay, well, that virus really just need to start acting in this area to limit that problem. And again, most of those things are just going to be supported. Any questions?
I was looking to see if Kelly, if you have any questions, I didn't see that you had.
Yes, we have a question. For the twin that you showed us the various video clips of, what was that eye disorder called, and how do you spell it?
So that is called strabismus, and it's spelled STRABISMUS. its comparison, I think, would be nystagmus. And when we talk about strabismus,
Nystagmuses.
and nystagmus is spelled Nystagmus. And nystagmus, strabismus, if you look at that calf, it was positional, right? So it was there and it was off, weird, and it would just stay there. So that would be a strabismus versus a nystagmus. We see it and they'll move either side to side or up and down. And so just terms that we would use, but strabismus is that. Interesting, I had a friend, he got hit in the head really hard and he had strabismus, and we always called it his bird hunting eye because this one would look this way. He was great. So that's, remember, just strabismus is sort of a bird hunting eye because they can live this way.
Thank you.
Yeah. Cool.
Yes, we've answered all the questions then.
Yeah, so I'll see you guys if you think of anything. I'll see you in a couple weeks, it sounds like.
Great. Thank you very much.
Thanks for joining us, Blue Valley. And I guess we'll just go ahead and close it off. Thank you, Dr. Miesner.
So what other kind of questions did you have? So I overheard a little bit, you have some 4-H